And good morning, everyone. It's time for our monthly visit with Ariann Wolff with West River Acupuncture and Wellness this morning. Great to have you in studio again this morning. Topic we're going to discuss this morning on our monthly visit is COVID long hauler syndrome.
That's right.
You brought that up to me, and I'm going like, okay, what exactly is COVID long hauler syndrome?
So, well, we have the acute symptoms of when we have COVID. COVID long hauler syndrome is the after effects of that. And just to be clear, you don't have to have actually had COVID to have COVID long hauler syndrome. You could have just been exposed to it. Like I hear a lot of times, well, my wife and kids have it, but I didn't get it. So your body definitely was exposed to it. Or it could just be getting the vaccine also. But it's all the same to your body and so it's the thing with COVID long hauler is it finds the cracks that were already there that we have, like our weak spots. And so the symptoms that come up for somebody that has COVID long hauler can be they're varied. If somebody already had issues with their heart, they can have more symptoms having to do with their heart. They already had some lung issues or digestion issues. I've even seen it where somebody had an old shoulder injury and they were asymptomatic. They tested positive for COVID, but then a week later woke up, could not use their shoulder. I've seen that the same with somebody's hip. Like they had muscles atrophy in their hip from an old hip injury, and it was after they had COVID. So that's the tricky thing with figuring out, is somebody dealing with COVID long hauler syndrome, which is really great because it's multifaceted, which is true for all chronic conditions. I said it's great. That's not what I meant. I meant that it's where my profession really shines. Like there was 2 years there where the whole world was going through the acute phase of COVID, and we all remember that. We don't need to talk about that right now. But now, globally, we're dealing with the more chronic after effects of having COVID. And Western medicine does really great with the acute phase of conditions and figuring that out. But once it goes more into the chronic phase of that, that's where my profession really shines because it is multifaceted. There's multiple reasons and multiple ways that you have to go about treating a condition.
So how would someone know whether or not they have COVID long hauler syndrome?
Well, there's no rhyme or reason to who gets it. It can be any demographic, any age. It could be our healthiest to our most frail population. So there's no, like I said, no real rhyme or reason. And I wish that there was a test for it, and there just isn't. All we can do is detective work and figure out together, and the timeline is really important. And so hearing all about somebody's story, did it seem like this came about for no reason? And that's what I hear a lot. Like all of a sudden I woke up and I was like this, or I used to have this problem with it. I was a kid, and then all of a sudden it came back. And so we have to figure out what happened there.
And how do you help with this condition?
Well, like I said, it's multifaceted. And so if I were to just treat that weak spot that COVID came in and just broke open, it wouldn't be enough. So we have to work on treating the virus as well. So we have to work on eradicating that virus. We have to come up at it from these two different angles. Otherwise, we're just not going to make it work. Otherwise, you won't get better.
Dr. Ariann Wolff with West River Acupuncture and Wellness in with our monthly visit. And if you've not heard us in the previous months, tell us a little bit about your practice and yourself.
Yeah, well, my practice is West River Acupuncture and Wellness, and we're just off of Jackson Boulevard. A little bit about me, I actually grew up here, and my husband and I, we moved around for years and years, went to school for Chinese medicine. I went to China and had an internship there as well. And my husband and I, we started having kids and knew that it was time to come home. And so that's why we're here, and so happy to be here and have my practice and be able to help.
All right. Anything else we need to touch on this morning?
No, that'll do it.
We've been getting some listener questions recently. So I think next month I'm going to because I told you earlier that we have gotten a few questions that we might have from our listeners too. So I think next month we'll want to talk about that as well, if that's all right, Kim.
I would love that. I love questions.
Okay.
Yeah.
Because we do have some that we have received and asking if acupuncture would help. So we will discuss that next month.
Well, I look forward to that.
All right.
I love to hear that there's been questions. So
All right.
that sounds good.
Thanks for coming in.
All right. Thank
See
you.
you next month.
Sounds good.
Dr. Ariann Wolff with West River Acupuncture and Wellness, our guest this morning here on News Radio KOTA.